Hi, I'm Nora Magnuson Mazzoni from the Magnuson Mazzoni Center in the Woodlands, Texas. I'm here with Michelle. I'm going to have her introduce herself and some of her qualifications and what helps with understanding a little bit of what we do. Michelle.
Thank you. My name is Michelle Robichaux. I'm an LPC in the state of Texas, and I'm also licensed in New Jersey. I'm the owner of Authentic Living Counseling and Consulting, and I have an office here in the Woodlands, Texas, as well as the Heights in Houston. A little bit about me. I'm a licensed professional counselor. I've been doing counseling for just over 6 years now. My background is in relational trauma, perfectionism, self-esteem, body image, as well as survivors of intimate partner violence as well.
Okay. A little bit about me. As some of you are aware, I have an LADC and licensed alcohol and drug counseling, and also LPC, licensed professional counselor. And I've been practicing with substance use for over a decade, and I have psychopharmacology for co-occurring disorders. So I have additional education when it comes to medication management and helping people to educate them and understanding some of the side effects and experiences with pharmaceuticals. So that is something that I do want to stress and the importance of, as we are going to be talking about ketamine and psychotherapy today, and the importance when it comes to a therapeutic process. What is ketamine?
So a little bit of just the history of psychedelic usage in psychotherapy. When I was thinking about this topic, and just for kind of all of you listening, Nora and I had a kind of a previous little small discussion about this, and we decided to expand upon it. What really came to mind for me was the use of psychedelics. We've seen this throughout history in indigenous cultures or more Eastern cultures, and that's actually been kind of used in healing rituals, which is kind of how ketamine is sort of marketing itself, right? Of like
Holistic approach.
Holistic, this is going to help you transcend, and you're going to reach, kind of
spiritual experiences
using it. So kind of just wanted to preface that of like, we do know this is a thing in healing, and not so much psychotherapy, but unless you consider Freud giving, his patients cocaine back in the day.
There's some controversy. Right? Some of it seems very valid, but others is like, did he have a substance use issue? Maybe.
Right, and we'll kind of dive into that too, but this has been used before. This isn't actually a totally radical new concept like it's sort of marketing itself to be. So it has been used before.
With different substances. This is now ketamine, more so.
Exactly. Where previously, where this has been used, it's been used more by shamans and spiritual healers, and it's more holistic, plant-based medicine.
Yes, it's more of a natural approach versus synthetics, but there are some synthetics, which we'll get into.
Right. And so what we do know about, as far as clinical trials of using psychedelics, and seeing its impact on human behavior and if it could have positive therapeutic side effects, that really occurred in the 1960s when the government was doing studies on holistic drug use. When we think about the LSD trials, if any of you are familiar with Ken Kesey and the Bus Further and his works, One Flew Over the Cuckoo Nest, right? All of that kind of came out of that. And essentially, after doing that study, it was kind of botched because you can't really regulate those substances, and there wasn't a lot of valid proof that it was being helpful at that time.
So more studies were needed, basically,
exactly.
And maybe held differently.
Exactly.
I want to point out, though, that we're not the only nation that has used different hallucinogens, specifically the hallucinogen category for substances. Hitler actually used a lot when it comes to methamphetamines and LSD.
That's right, yeah.
Yeah, and with soldiers and experiments on, different populations and things like that. So there is historically medication that is of a natural and or synthetic approach, or developed that used on people to see how it affects them on a spiritual and also
performance level.
Performance level, physically. Yeah.
Well, and that's right. I think kind of the allure, this is kind of jumping a little bit, but allure of this idea of maybe using ketamine in therapy, right, is like, is it going to help me get to a higher level? Is it going to optimize my functioning as a human being, get on a higher spiritual plane? Or like methamphetamines, right, or stimulants, is it going to help me perform better and move faster, be stronger, et cetera, et cetera? So in recent years, ketamine-assisted therapy is gaining popularity in the U.S., and it's, ketamine clinics are becoming much more readily available, much more popular. We see them kind of popping up everywhere, and it's becoming quite commonplace. So.
Oh, yes. I mean, I see marketing material on Facebook, and I mean, just social media in general is really marketing this, and other platforms that support therapists and people seeking for therapy is also, they are trying to educate providers and provide the therapy.
Right. And it's also being marketed at home use, right? Like this idea of, I don't even need to go see a therapist. I can get the medication sent to my house and just do it there. We'll talk about kind of, best practices a little bit later about like how it should be administered and what are best practices with that. But, it's kind of being marketed as this is kind of very effective and fast way to treat specifically trauma, but a whole host of other mental illness.
Wow. I honestly, you may have told me before when we were talking about this, but I don't recall that it's being administered at home. So I really want to know more about that.
Yeah, we'll definitely
get into that in a second.
I'm getting ahead of myself.
So what is ketamine? It's a dissociative anesthetic hallucinogen. Okay, there's a lot that goes into that. It's a mood-altering chemical. It's definitely, it hits the neurotransmitters and receptors, and so how we process in our brain neurobiology of medications. So the effects, it does affect the nervous system, which is highly important in working with trauma. Every time I'm working with trauma, I'm always trying to regulate the nervous system.
Yes. Yeah.
And what is your experience with regulating nervous system when it comes to the therapeutic approach with trauma?
Right. So I know we've talked about this as well, but I am a holistic-based therapist, so I use a lot of body work, and so that includes like tapping, EFT, but also just focusing on the somatics, right? And that's why, as you're saying, right, and whenever we go into a dissociative state, it's a trauma state, right? So, I mean, in a sense, when you're taking ketamine, you are putting yourself in a dissociative state, which is activating the fight or flight response, right?
The polyvagal theory, fight, flight, or freeze, immobilization.
Right. More parasympathetic in this case because dissociation, but yes, exactly. But polyvagal theory, 100%. But, it's important that we notice our clients' breathing and heart rate or how they're moving in their seats, and so we can help return them to homeostasis, right? Return them to a place of balance where they're not going to either far extreme, right? We don't want them too activated, and we don't want them
overflooding.
Right.
We don't want overflooding, and that's where the nervous system comes into play, because that's all happening in the nervous system. So it's an agonist, which binds to and causes activation of the receptors. So basically, it binds to the receptors and fills them to be able to provide the sensation as though someone is receiving that substance. So, for example, opiates. That's just a common theme that you're going to hear a lot about is the dopamine and opiates. Opiates hit the dopamine receptors of filling that receptor spot. So the agonist in this case is not a synthetic. It's actually a true natural form of receiving a drug. Basically, your brain thinks it's receiving that drug. In this case, ketamine is the drug, and it's filling the receptors, and there's multiple receptors, and including it hits the dopamine receptor, which opiates hit. It also hits the GABA, and it the NDMA. I don't know.
DNA?
NMDA.
Yes.
Yes.
Yeah, that's what it
that's
is, right?
It's all okay. It takes a moment. It's a lot of information, but those are the ones. And then it's an antagonist, so it blocks also receptors. So it's blocking and also filling receptors. So your brain is having this network of occurrence, which is what triggers the dissociative and the symptoms and out-of-body experiences that some people have. In 2019, the FDA approved it for therapeutic purposes. Prior to that, it was used as, the words are coming to me, but it was used for animals and people for, I can't think of what it is. It's physical sedation is the word that I'm looking for, sedative purposes, and now it's used for other purposes other than that since 2019 in the U.S.
Which is sort of interesting, right? Because it's a hallucinogenic. I never think of those as being quite sedative, but it is also
if you're out of your body,
activating
you're
the
not
parasympathetic system. Right. Maybe it just doesn't mentally feel very sedative.
It's not something that you typically see.
Right.
Because when honestly, before this, I've heard of it more of a sedative, hypnotic, but really it's a hallucinogen.
Right.
Not a sedative, hypnotic.
Which
is interesting.
It is interesting. Very, So, talking about the pharmaceutical drug names versus kind of street names, because ketamine has been around for a long time, right? It's not, again, something new. And, we have seen it being abused and used in other forms as well, not just in a purely medical or psychotherapeutic way. So, do you want to talk a little bit about those?
Yeah, the pharmaceutical, there's other ones. There's a name that starts with an E, but it's not used in the U.S. as much. But there are different pharmaceutical medications that come from, that's derived from and uses ketamine specifically. And so there's a list of them here. And the one that the U.S. uses is Ketamine. And I could have botched that. I probably have. But there is a list, and it's in the PowerPoint if you want to look up some of that information of names to see if there is medication that maybe you're administered or just to know more information about. The street names, there's tons.
Yes.
There is a ton. The ones that I'm more familiar with before even putting this together was like In the Hole. Have you ever heard of that? With the Dragon in the Hole?
No,
have you ever heard of
I
that?
have not. Oh.
So With the Dragon in the Hole is actually a combination of heroin and ketamine mixed together. It's the dragon is the opiates, the heroin, and then there is the hole is the ketamine hole. So you'll hear that people feel like they're in a hole, like deep down. It brings you deeper in.
Yeah, I know that, like Alice in Wonderland, going down the rabbit hole feeling, right?
Yes.
Like, yeah. That's interesting. I had heard Special K. That's the one that I'm most familiar with, but that is an interesting sort of analogy there, or kind of name reflecting sort of that feeling, that sensation.
Yeah, and I think I have it in other parts of here, but I can tie it in, is that ketamine is typically taken by itself, but a lot of time it's actually mixed into other substances. So there's different names that go along with that, like Dragon in the Hole.
Right.
Like I'm with the Dragon in the Hole. And there's cat tranquilizer, cat Valium, Jet K, Kit Kat, purple, Special K, like you said, Special La Coke. Did not hear that one before, and I thought that was interesting. Super acid.
Or Special La Coke, it with, I'm just sort of curious if that's with it, laced with maybe a stimulant.
It could be. Cocaine.
Yeah, something of that nature, but I could be wrong. But
vitamin K, which is interesting because infants at birth get vitamin K shots. So I think that it's important to know the difference of when someone is talking about these types of things, what are they referring to? And is my child have I heard these terminologies with my kid on the phone with their friends or texting, saying some of these things?
Yeah.
And having awareness of that.
Yeah. No, especially some of these Special K's, vitamin K, you could definitely Kit Kat, right?
God. Even totally. They mention it as the name of God.
Right.
Interesting.
Right. Which
How powerful is that?
It's very powerful, but it kind of goes back to that rabbit in the hole idea, right? This idea of kind of ego death and having sort of a metaphorical death to reach enlightenment. So
spiritual component.
Kind of dive into that. But
yeah.
Yeah.
Do you want to go over the next one?
Sure. So common disorders right now that are treated with ketamine, a lot of research has been done on specifically depression and anxiety. Trauma, PTSD is also, it's really being talked about right now in the world of trauma. I mean, in general right now, trauma is a hot button topic. I think both of us as trauma therapists see that there is a high need for that. But also there is, I think, in a way, there's like this push for everything needs to be trauma informed, which I think that is definitely true. We need more awareness, but also it's almost sometimes that because there's such a push for things to be trauma informed and such a hot button topic, right? It's like, is everything a treatment for trauma, right? Or, you know, kind of everything's being marketed as that in a sense.
In a sense, very much so.
Right.
In addition to co-occurring disorders with substance use disorders and trauma being promoted using ketamine right now.
Right, right. Yeah, substance use, schizophrenia.
What are your thoughts on that?
We'll dive into that.
Yeah, okay.
I feel like we will dive into that, or but also substance use and suicidal ideation as well. Yeah.
The common symptoms and possible side effects, there is a pretty hefty list that you can look at on the PowerPoints, but I wanted to go over the most common symptoms for people, the common symptoms of what do you expect to experience while using ketamine in general, and also through the therapeutic process that people use this for. It's similar to PCP and LSD. And so there's this hallucinogen category, which PCP and LSD is a part of, right? And so you're going to have similar effects. Distorted perception involving sight and sound. So that goes into hallucinations as well, of auditory hallucinations, visual hallucinations.
Somatic hallucinations as well. Yeah.
The feeling sensations in your body and what they're experiencing.
Yeah.
With also disconnection, apparently, of like really feeling disconnected out of body experiences.
Right.
Memory loss memory loss. Not knowing what the heck just happened while through the process of therapy.
Yeah.
I mean, that's a good thing in some cases with helping to regulate the nervous system afterwards for the trauma experiences. What are your thoughts on that?
Yeah, so when I think that's kind of the tricky point of all of this, right, is the memory loss aspect of it, because if what you're experiencing in that high is so dysregulating, is that not just re-traumatizing, right?
Yes.
And that's what our memory dissociates. Our brains literally cut off our ability to remember or recall events when they are too traumatizing.
Yes.
Right. So our body is literally being pushed into a state where it is trying to protect itself, which is sort of interesting that this is being marketed as a way to treat trauma.
Yeah, because you're correct. In a trauma response, a dissociation is protection. And in this case, when people are doing trauma work, especially trauma work, and if they had that experience, does that correlate with re-traumatization or even increasing the trauma that they've experienced?
Exactly. Yeah.
I mean, if they don't remember the event, then how's it reprocessed?
Right, because a lot of reprocessing, we see this at the EMDR, we see this with brain spotting, we see this with different forms of therapy, right, is integration. Being able to integrate, consolidate the memory, make meaning of it, and then having that linear timeline of past, present, and future, right, of I'm not back there. So if I'm not remembering what happens, then I'm just getting stuck back into the cycle, right, stuck back into the trauma.
Yeah, wow. That's very profound. I mean, I think that's one of the biggest takeaways for me right now of really talking about using the ketamine and the memory, because memory isn't so important, you know, and the loss of the memory. Where did it go?
Yeah.
What happened?
Yeah.
I mean, for me personally, that would be scary.
Yeah. And I think that's something to talk about too is, you know, it's being promoted as this, like, you'll reach spiritual enlightenment. And, you know, I kind of want to play devil's advocate a little bit of like, there might be some clients who could find this really helpful. Yes. There might be some people who might really benefit
They don't want to remember.
Right. Or maybe they are able to kind of reach levels if they're in a calm enough state where they can maybe kind of think creatively or think out of box. You know, I mean, you know, one
to
flew
then
over.
create their own way of healing, but then if they don't remember it, is it healing?
Right, which is...
So, I don't know.
Yeah, and that's where it's like, what's that level of dysregulation, right? What's that level of, because if somebody's able to maybe maintain themselves in a calm state, it could be helpful. But if somebody's not, which...
That's the concern.
If you've never experienced something like this before, it can feel very unnerving if you're starting to experience visual or physical or auditory.
It's a trip.
Yeah.
You're literally having a trip on drugs.
And that can feel very scary, especially...
For some people.
Yeah.
Is it a good trip or is it a bad trip if we're going to talk about drugs?
Exactly.
Right? It's like, am I having a good trip here?
Exactly.
Is it a healing experience therapeutically? Or is it like traumatic? I mean, they don't remember.
Yeah. So, yeah.
It's interesting. Immobilization during the process, not being able to move because they're disconnected from themselves.
Also a freezing response, if you think about that from, again, polyvagal theory. So, yeah.
Yeah. And then it usually lasts, and I think this is important to recognize, is usually the high and the initial effects last 30 to 60 minutes, to opposed to several hours like LSD or PCP or other chemicals.
It is much more fast acting, or that shorter half-life.
Yes, exactly. Possible side effects, these are the ones that could happen but don't always commonly happen, and this is during and after, is agitation, depression, which is interesting. If they're treating depression, we'll see how, hopefully they have a positive experience with it and don't have increased depression. Cognitive difficulties, that's pretty heavy.
Yeah. So that, and that's the thing to remember, right? Going back to the memory, like what is happening to the memory centers of our brain when we are taking, especially a synthetic chemical, right? And kind of ingesting that, and especially if we're ingesting it in more than one dosage in large amounts, which we'll kind of get into all of that when we talk about how it's administered, but what is happening to, our ability to retain cognitive information, our short-term memory, our working memory, all of that.
Unconsciousness, which is heavy because we're going to talk a little bit more about that, but unconsciousness, not being conscious during the process. Amnesia, which kind of goes into memory. Involuntary rapid eye movement, which is kind of a good thing, maybe. It could be a good thing. Sleep states have that, and also EMDR and other methods of ART, accelerated resolution therapy, uses eye movement, so that could be a calming nervous system response of trying to regulate or a sleep state.
Yeah, that is true. Yeah. Then salivation, it looks like.
Salivation, dilated pupils, tear secretion, like crying, which, tears are healing.
Yeah.
And if they're having a positive experience or a healing experience, it could be. But it also could be a sign of distress.
Right.
Overdose does occur, and I believe it was in the 2019 to 2020 that they had 6 overdoses, according to the DEA, or the federal government. So it's not as common, and that was for street usage that I'm aware of, or at least overdoses in general. It didn't really specify. So overdose is possible. Unconsciousness is typically the symptom that you see with overdose, and shallow breathing, which does mimic opioid overdose. Right,
which is something to be very concerned about, right? Because when our breathing, the shallower breathing gets, the more likelihood, right, or there's increased risk of like just kind of our nervous system collapsing.
Exactly.
Right, which is really dangerous. Like that's I think the key thing to take away from kind of anything we're saying here is, if this is something that you choose to utilize either as a therapist or as a client, being aware of the possible side effects and the risk involved is highly important.
Yes.
Right, because we can't, as therapists, tell you what's best for you, and you are the expert on your life, but
having that education and that understanding of the possible side effects can help save your life and or help you make an educated decision on what you want to do for your therapy or therapeutic process that you offer your clients.
Exactly. And what choice is best for you ultimately.
There's stiffness of the muscles, which is common work with any somatic experiences, typically hallucinogen persistent perception disorder, which I've never heard of until looking at this. So continuing hallucinations after the fact, that it's worn off, which is kind of concerning. Reported several weeks after ketamine use. So there are reports of it continuing for weeks if you do develop the hallucinogen persistent perception disorder, and then the experiencing prolonged visual and disturbances, which goes into hallucinogens.
Yeah, and it ties into kind of, right, like psychosis, risks of psychosis.
You're right.
Yeah,
that is psychosis.
That could be, and you could kind of unlock that or be in a state of psychosis and never come back down.
True.
Right? So.
And some people might hear about that as like, untherapeutic statement of like permanently fried, or that's on the streets. That's what they talk about, of using methamphetamines or other street drugs that does negatively impact the brain. And therapeutically, we look at that as there's long-term damage cognitively in the brain and how it's processing, that now we've developed a new disorder.
Right. Right. And so that's the important thing to remember, right, is this is going to alter your brain chemistry.
Yes.
There is no way around that, right? And so when you are taking it, you are inherently altering your brain chemistry.
Your state of being, your brain. Yeah. Yeah, and hopefully, it does have a short shelf life. But there are always risks with taking any drug, whether it's prescribed or not prescribed.
Yes. So do you want to talk a bit about evidence-based research?
Yeah, I found some evidence-based research, and there's a couple out there, a lot of them promoting the idea. So there were some that I feel were a little biased, but I did find some that were more meta-analysis driven, with multiple, meta-analysis of looking at multiple studies and putting it together to help educate. The government, there was the U.S. government and Netherlands, Australia, did a meta-analysis in 2023, so this year I believe, it showed a 50% effectiveness for MDD and PTSD. So 50 was the outcome. So it helped 50%, and a lot of those people were resistant TRD, so treatment-resistant depression. So they did not have as well of an effect with other pharmaceutical medication. So it did help 50% of those people who, have issues with PTSD and MDD. Then depending on the resource, and that's why I talk about it, that there was some resources that showed 70 to 80% effectiveness for treatment-resistant depression. So that's very vast, though. Going from 50% of a meta-analysis to 70 to 80.
Yeah.
And that's why I wanted to include the meta-analysis.
Right.
Because it's like looking at studies, single studies. It was very okay. I sense there were some biases in them, to be honest.
I also think it's important to talk about therapeutic buy-in and also types of clients who might be not only more, maybe, because that could impact outcome too, right? If I'm already having this buy-in that I'm going to have a positive experience using this drug, or I believe that maybe...
Like placebo effect?
Right.
Like the buy-in?
Yeah. Effect. And that hope factor is super, super powerful, right? I mean, we know that placebo effect has such a tremendous impact on if we feel like we're going to have a positive outcome, right? Or if we get the results that we want. But it's important to kind of be mindful of where these sample sizes coming from, right? Are there people who might be more willing to kind of use alternative substance in treatment, and maybe they're already kind of, whether that's a value-based system, right, or culturally that feels more acceptable to
more
them.
Natural, holistic, and
right.
That's really what they believe in, and their belief factor, and helps them feel like it is benefiting them.
Yeah, then that would kind of make sense. But again, it's kind of all these things that they're just throwing these blanket statements of it's 80% effective, and it's
70 to 80.
Right, but who's your population? What was it normed on? What resources did they have? How was it administered? All of those things are very important.
Yeah, and I love the studies. I love studies. Okay, I like numbers, and I like to know what's effective. And that's why I really had a hard time with this. Because looking at those individual studies was very challenging because it just, I don't really know the validity effect. And that's one thing that actually I didn't put it on here on the slides, but the validity in the government meta-analysis, it talked about validity of a lot of them and needing further research, and the validity, some of them was not as effective.
Yeah.
So I think that more research is needed, definitely.
100%, which goes right into sort of the next talking point about how it's being administered. Mm-hmm. And I think that's exactly what's happening, right, is I'm sort of just going to share the ways that I've heard from, kind of asking around and, kind of just talking to other therapist experience or people who have maybe seen clients who have tried this modality. But as far as I know, I'm not aware of any standardized way of administering ketamine in treatment.
It's kind of open
right.
a little bit for... It's not regulated as much right now. No, we're in a new phase. And it's like a new thing where people are like, oh, it works. It's been FDA approved. So we got the golden stamp. So, and it's new, so there's not as much regulation.
Right. Which, is kind of where we fall into this, okay, well then how are we going to use it clinically, and how do we mitigate those risks that we talked about earlier? So a couple ways that it can be administered. So usually, unless the therapist is a psychiatrist, they cannot prescribe medication. But the client can go about getting prescription in a number of ways. So the client could meet with a psychiatrist who is just willing to prescribe them the prescription, right? And so that's where you can kind of hear about people being administered it at home, right?
Okay. Yeah.
So if you can just find a psychiatrist, telehealth doctor, and some of these clinics do offer that.
So do they have to have the telehealth with it, or are they just going home and saying, here, have a good trip?
So it depends on the psychiatrist.
Okay.
And the provider, right? Okay. Best practices is that they are taking it in conjunction with individual therapy.
At the same time?
At the same time, or you take it right before you do your individual therapy session. Okay. Right? So you don't come into
like you're ready to go.
So this is where it kind of gets tricky.
Yes. This is where you know more about it than I do. So I want to learn.
No, yeah. So some therapists will have the client take it with them in the counseling room, and maybe they'll do a longer session, like 2 hours, hour and a half. So they go through the process, the high, the trip, they come back down, regulate them. And in that way, maybe it can be very therapeutic, right? Because the counselor is able to monitor the client's, bodily responses and ground them if needed, right? And then they can
help regulate the nervous system and anything that has happened during the experience.
Exactly. And usually during that time, the therapist is more of just kind of reflecting, not necessarily guiding the client or kind of offering interpretations, but kind of letting them go through the process, helping de-escalate them if needed, and then processing it afterwards of what came out. So there's that meaning-making process afterwards of, what came out of that for you? Where I can see in some ways how that could be beneficial, right? Because you're having the grounding, right? There's that safety net.
Yeah, you're processing it afterwards.
Right.
And they're bringing up some of the information that they've been through.
Mm-hmm. Yeah, or what happened, what was that experience like? What did they see? What did they feel?
What if they don't remember? Then does the provider, the therapist, bring up certain experiences?
So the provider could say, this is what I noticed when you said this or that. Like the provider might take notes, or the clinician might take notes. But some providers, some therapists might have the client take it on their own, which they can either do at home if they have their own prescription, or in a ketamine clinic. And so and then maybe they meet with the therapist later to process it. So like the next day or that afternoon, right? So that's another way that it can be done.
Okay, so they're not monitored at that point as much.
So in the ketamine clinic, they are monitored. They're usually kind of in a room, and I think sometimes they're given like a weighted blanket or maybe water. But they're not necessarily guiding you through therapeutically. They're not de-escalating you. They're not looking for those things. It's just a place where you can go and know that you're being kind of safely watched while you experience the high, right? But not necessarily someone being attuned to you and kind of there with you during the experience, right? taking it at home, it's just kind of you as the individual on your own.
Okay.
Right?
Mm-hmm.
Now, some ketamine clinics do offer therapy in conjunction with it, but some you are just purely going there to have the experience. Where they offer observation and a private room where you can experience that.
Okay.
Yeah.
And I'm wondering if those types of clinics are regulated, well, not regulated, but overseen by a medical provider or a psychiatrist typically.
So they're typically on staff, and those are typically who prescribe the medication.
Okay. And they're on the sites, hopefully.
Mm-hmm. Yeah. Well, as far as I know, right,
there's no regulation, so they might be prescribing it and have staff that's overseeing it.
Yeah.
Okay.
I think that's actually more common.
More common, okay.
Yeah, where it's these kind of like pop-up ketamine clinics, and maybe a psychiatrist is kind of connected to multiple ones at multiple different locations within the same area.
Okay.
So.
Mm-hmm. Well, that's very interesting. I think that there's there's different avenues and ways of doing and administering. Well, you need a prescriber to administer it.
Yes.
To prescribe the medication.
Yeah.
And once you do that, then there's different private settings, home privacy, being able to have that in your home can be a benefit of feeling safer for some people versus in observation rooms in the clinic, if that is something that might be triggering for them. But there's also the possibility of having something significant happening and not having support from staff.
Yeah, and it is a controlled substance too. And so I do think the ketamine clinic is the much more popular route or much more common. And I think prescribers will usually use that one or like refer them to a clinic because the staff then can control the dosage, right? So that's also less risk of overdose or potential harm to the client. So, but yeah, there's a lot of kind of loose ends, right, to all of that of safety and what's best for the client and, kind of is making sure that they're doing the substance in a safe space and have the resources available to not only keep them safe, but also, not further traumatize the individual.
Yeah. Anything else about the clinical settings that you wanted to talk about?
I think that is the information that I have to share. I'm sure, even
there's
as this
more
video comes out, new things is happening every day, and there's much more. But
that's a lot of information that I wasn't aware of, and I think that it's important to look at different ways of administering it, taking it if you feel safe more at your home, maybe having a buddy system or someone there to support you if needed, and really having a plan in place if you need to seek medical attention, if you need to have help. Because I've shared that I'm in recovery myself from chemical substances, and part of that is I've been on trips that were great, and then I've been on trips that were not great, and I needed a monitor.
Right, that ego death. Yeah,
and you don't always know what you're going to have.
Yeah.
You can get triggered by the slightest thing, and then you're just down this road of Alice in Wonderland and dread and really a bad trip, or a bad experience and traumatic experience that can happen from that. But then I've also had spiritual enlightenings from doing certain synthetics of hallucinogens before, which I'm not going to promote. So, but I've had those experiences where, I've had the impact of spiritual enlightenment before, but I've also had the other too. And I'm grateful that I had support in the times that I did not have such a great experience because who knows what would have happened. Yeah.
And that's the important thing to really kind of drive this point home, right? It's like, yes, some people can report feeling euphoric, having those spiritual experiences, and I appreciate you sharing your experience. But there's always the risk that it could go the other way, right? And so that is something that I encourage you, if you're a client, to really consider as, there is that risk. And does that feel like it would be something that would help your treatment and that you could recover from and process with hopefully a trusted therapist and provider, right? Which is kind of why it's nice if a provider is able to offer that space, safe space.
Safe spot, yeah.
Or is that something that feels like it would potentially maybe be harmful for your treatment or
re-traumatizing and harmful? Yeah. That's really only you can decide, and a provider. So I think it's important to know that you and I, we don't provide this service, but we're educating ourselves as we're looking into it to see what the therapeutic benefits and also consequences can be. And so we want to educate you on what that might be for you as a provider and also possibly a potential client.
Yes. Yeah.
So cultural considerations.
Yes. We're so in sync.
Yeah. Cultural considerations.
Cultural considerations. So when I was thinking about this, and this is probably because this is a subject that's near and dear to my heart as a holistic therapist, as also a feminist therapist, and just my own experience of being a Reiki practitioner, which is something I use. I use psychotherapeutic Reiki with clients as well. And this is really kind of a topic, and I'm going to curse, I apologize.
No, go ahead. I welcome it.
Well, it's the bastardization of different cultural practices and different healing cultural practices at that, right? And I think it's important that we talk about this, right? Because it's being marketed from a very Western lens, right? If this is going to be this effective, research-based, evidence way of treating trauma, with
so
this
over-intellectualizing it.
Exactly.
Yeah.
With this synthetic chemical, right? When, again, as I mentioned at the start of this video, it has been used throughout the dawn of time in ancient cultures, by shamans, by healers, right? And it's still being used today, right?
It's not something new for certain cultures. It's more out there with the Western culture currently.
Yes. And so when you think about that, right, is this previously would have been seen as pseudoscience or not having scientific backing, but the second we make it a synthetic chemical and we slap the FDA approval on it, now we can market it for Western approval, right? So keep that in mind when you are doing, if you choose to use ketamine in your treatment, just kind of be aware of, where the history is, right? And really the time when you would use these mind altering substances, which again mostly came from like roots, plants, or mushrooms.
Yes, mushrooms. Very well known, and yes, I've done it.
Right.
Just saying, back in the day before recovery.
But also organic substances too, naturally occurring substances. Yeah. They were usually part of like a sacred ceremonial ritual, which
and they
means
still do it.
Yeah, and this shaman, let's say in indigenous cultures, was there to guide the individual through the journey, so there was already kind of that safety net being built in, right?
Which then, if you look at it in our way, they're the therapist.
Exactly. It's the healer, right?
The healer.
Yeah.
The natural healer, holistic approach.
Right. So it could have benefits, right? It could be beneficial for many people. It's just, how is that process being done? Is it being regulated? And also, let's give credit where credit is due, right?
It's not something new. The cultures have been doing this from the dawn of time. You can't tell me someone didn't find it way back when and be taking it, and they're like, oh my God, I had a trip, but don't have the words to say it.
Right.
And they're like, hey, this helped me, or I had this experience. Here, you take it.
Yeah.
And I mean, that's how a lot of substances are formed, as therapeutic, holistic, cultural aspects.
Yeah. And kind of one thing on that too is, this wasn't something to be used all the time. This was, you go to the shaman or the healer and they administer this treatment, if you will, right? This ritual to, usually was sort of a cleansing process, right? And that was supposed to kind of rid the body of toxins, or, kind of on a spiritual level, right? Like healing, right? Or kind of rid the body of
spiritual healings, biological healings,
right? What was ever blocking, if you want to use the chakra system or whatever that might be. But yeah, it wasn't meant to be a commonplace usage. It was meant to be in high reverence. It was meant to be seen as sacred.
A traditional aspect.
Yes. Yeah, that's a great way of putting it. So, again, ketamine is a synthetic chemical, but it's being promoted as holistic and complementary, right?
Well, it is a synthetic when it's developed by the pharmaceutical company.
Yeah.
But there is non-synthetic ketamine, just like opioids and opiates. The opioid is a synthetic. The opiate is the actual opiate that you'd get from opium.
Yeah, or poppies. Yeah, poppy seeds. And that's something to, I think, be mindful of, because what we know is typically when they're synthetic, it's made for mass production, right? It's easier to get, readily available, and sometimes it can have stronger effects too because of that, versus these more naturally occurring substances. They're not as maybe strong or as potent, if you will. Yeah. So again, just kind of bringing this point home, you know, when we think of like the roots of, you know, patriarchy and colonization, especially colonization of like healing practices, it is something to consider, right? With like how this is being marketed as sort of this new groundbreaking approach, when it's not really groundbreaking.
It's like a fad.
Exactly.
Like therapy, like every other type of career and avenues. The words are escaping me, but just like every career, there is this phases of fad, like the focus points of what is the new age thing that people are utilizing. And right now, ketamine is it. And
it's being whitewashed. These more, you know, traditional, I would say, healing practices are being whitewashed, which is making them more palatable to the general public. But then we are kind of erasing the history,
the cultural components,
and the cultural components of how this has been respected and honored and cherished in, you know, more Eastern, more indigenous cultures, right? Like it deserves its place. It deserves to be known, and we really need to respect the origins, or at least that's
respect the people who have been using it for so long. That this is a part of their traditional aspects, so that's important to them, that they hold dear, and not to just intellectualize it and forget about, like you're talking about, the whitewashing it and making it all clinical when there's the spiritual components that are so vital.
And honestly, marketing it for profit, because that's really what it's boiling down to.
Dollar
right?
signs, I mean, it's expensive, I'm sure. Are you aware of how much this goes for about?
You know, I am not, but I would assume it is a pretty penny. I know these ketamine clinics are quite profitable, so because it's not just you're paying for the ketamine, but then you're also paying for the room.
So you got substance, and which FDA approved, pharmaceutical. I don't even know if insurance would cover it.
They do.
They do.
Okay, they do.
So
depending on your insurance and your plans. Yeah.
But some people are paying out of pocket. And if anything is FDA approved and insurance is covering it, then usually prices kind of go up a little bit. And then you're paying for the room, right? And I think there's different levels of different rooms that you can have. So like maybe you don't get the weighted blanket in one room, and then the other room you do. And so like, you know, it becomes like
very
concierge.
Quickly, exactly. Which then if you think about it, you know, I mean, we can go kind of, not to sort of drive the point home, but down the rabbit hole of like wealthy elite probably getting access to better care, right? And so maybe cushier rooms and nicer clinics, and probably clinics that can afford to pay a staff and have therapists on site who can, you know, de-escalate and provide, you know, those therapeutic experiences versus, you know, maybe clinics that aren't as, what's the right word I'm looking for? But clinics that maybe don't have as much means.
Socioeconomic status.
Right.
Like, what does that look like? Am I going to a place that is clean and have good staff? Am I going to a reputable place that is going to support me if I was taking it in a way that I would need and know the procedures that hopefully would support someone? Or am I going to a place that is
for profit,
the money's not going back into the clinic or the staff as much?
And I mean, we see that all the time with substance abuse clinics, right? Like, you know, you'll have the really nice cushy one where you do yoga and hot, you know, have access to a sauna and all those things, and then you have the ones that are, you know, where they're not being offered those services. And
Yes.
that's a whole other topic for another day.
Yes, it is a very big other topic. Yes, but I think that's valid, and I think it's also important of looking at where are they locating these clinics and what type of communities,
Yeah.
and the socioeconomic status and the effects of the community and prevention. And I know from experience of working in Minnesota with the methadone clinics, and also in California working there and living there, of the when marijuana recreationally became legal, on the access of the stores that people were able to obtain substances at a cheap, and where they were located, and the effects, negative impacts that it had on the community.
Yeah. Which, again, kind of bringing that to a systemic level, right? Of think of all these things of colonization, patriarchy, right? And again, it's kind of feeding who's at the top benefiting from all.
You're not
going
to probably find a ketamine clinic in a very rich neighborhood,
right?
Typically,
yeah.
I would be surprised, and if there is, then they probably have concierge services that will be more expensive and catering to that class.
Yeah. Yeah. Which then, kind of just bringing that kind of home to a point of, is this a way of just keeping the sick sicker?
Yeah.
Which is something we have to consider anytime we do any treatment, right? Is
are we doing harm?
Are we doing harm, right?
Supporting.
Yeah.
Yeah. So there's a lot of questions.
Yes.
A lot of questions.
Which we have not begun to answer today, but hopefully this is a dialogue and discussion.
Yeah, I mean, I think that this is a lot of good points that bring up questions, and those questions are healthy, that we'll continue to see.
Yeah.
And people are going to have to discover them for themselves and do the research and or explore it themselves.
Yeah. Yeah. So take this as your starting point, right? This is something that is meant to kind of maybe challenge some preconceived notions, educate you a little bit, but also do more research that's out there as well. So potential concerns, did you kind of want to touch on this, or did you want...
Yeah, I can touch about some of it. Is the links to opioid epidemic and fostering developments of substance use disorders. The way that it's been marketed is that this is a cure-all. That ketamine is a cure-all, and I'm hearing this from people who are providers who are seeking out getting more information and becoming providers of ketamine therapy. And so a lot of what I'm hearing is oh yeah, it treats substance use. It has been shown to, for lack of a better term, of curing in a way, without saying cure, because we don't typically use that word of cure, but really promoting it as a cure-all, of saying, benefit outcomes, and that it's being treated and showing no effects.
Yeah.
No longer having, that's really it, no longer having substance use issues, no longer having trauma after one application of ketamine therapy.
Which is a bold claim.
That is
a very bold claim.
Yeah. That is, no therapy I've ever seen can only do one application.
Yeah. Well, and that goes to kind of the point I was making kind of here on the side of, we know from neuroplasticity that it's repeated exposure, right, to positive or corrective experiences. It's why you're not done after one therapy session, right? And you sometimes need to recarve those neural pathways over and over again. It's like building a highway system. You're going to go down the same road unless you have a new road, and that new road takes time to build.
Which is that reprocessing part,
Exactly.
which is talked in EMDR, ART, and some brain spotting, and a holistic somatic experiencing of the body keeps the score, right, and the memories stored, and processing those memories and speaking them out,
right,
and having that repetition of when it comes, if it comes back, which there might be some lingering, then continuing that process,
right. And so if you're not getting that, if you're just taking the ketamine, having this high, let's say it even is a good high or a good experience, but you're not reprocessing it, you're not building those neural pathways, then it's not going to be as effective, right?
Which there is, and I want to point out that the therapy after, if you had that experience and you're able to process it with a therapist or provider, then would that be consistent with the reprocessing?
It could be, in a way. I mean, I think, right, it depends. But in a way, it is reprocessing, right?
Being reprocessed. And then that brings up the question of me, am I reprocessing it for myself? Or am I being told what to reprocess?
That's a good point.
So then as a clinician, this brings up, and as we're talking about it for me, it brings up, am I going to be liable for misinterpreting any information?
That's true.
Without, yes, I'm saying this is what I experienced, this is what I've seen, but there's a lack of memory and amnesia. I mean, the liability factor on that would be high.
Yeah, that is definitely a good point. I mean, we didn't even really touch on like liability as the provider or therapist, but like that is a huge thing to consider, right? Is like, and in a way, they're kind of being put in a suggestive state, right? Like there's a lot of many things that I think need to be considered more with this treatment. Not
regulation.
Right, exactly. Like, I'm not saying let's throw the baby out with the bathwater, but like,
let's keep the cultural components, but regulate it a little bit.
Right. We got to blend these two, right?
Let's meet in the middle somewhere.
Yeah.
Safety.
One thing I did want to mention, we talked about this quite a lot, was promoting avoidance-based coping strategies, and I think I'm finding this kind of more commonplace as I think spiritualism is gaining a lot of popularity, but again, it's kind of spiritualism through that Western lens, this idea of like detachment, nothing affects me, right?
Wow, yes, you're right. I didn't even think of that dissociation part and promoting detachment.
Yes.
Oh my gosh.
As a spiritual enlightenment, when we look at actually, spiritualism and enlightenment in Eastern cultures, detachment is a part of that, but it's not framed from a Western point of view, right? It's like more of an interconnectedness of I am detaching from my own ego to connect with others, to feel more grounded in oneness versus nothing affects me, right? And I'm sort of like detaching from it all.
Yes. Wow. What does that promote as a trauma therapist?
Right.
I mean, seriously.
I mean, a lot of avoidance, right? And avoidance attachment at that,
That's like what you don't want with trauma work.
Exactly.
We don't want them not to connect to themselves.
Or others. Right.
Because that's trauma.
Yeah.
Yes, we talked about this, but like, I'm just trying to conceptualize this right now because it's really just coming to me a little bit. Like, really.
Yeah.
I think that's so important because like, I don't know, I'm speechless, to be honest.
Yeah. Well, I hope that's a good speechless. But
it's a good speechless because it really, if I'm working with someone and they're not connecting and they're dissociated, and then I just say, oh yeah, you experienced this.
Right.
Leave my office.
Yeah.
I mean, we're taught to ground them.
Yeah.
To connect them to themselves, which they might get in the follow-up therapy, right?
Right.
But like, that's just really, it's baffling to me, to be honest.
It is extremely baffling. And so it kind of showing a little bit of my own therapeutic style here as someone who uses a lot of chakra work, which is something we've talked about. The root chakra is the first chakra for a reason, right? We have to be grounded. And so, when we integrate that
the opposite of dissociation.
Exactly, right? We need the crown and root to be connected as one. And so if we're too far in either way, that's not good, right? And so, but again, it's this kind of, we're viewing things from a very Western frame and not actually honoring and understanding the cultures that have kind of informed these spiritual practices, but we're using it for profit, and we're able, or not but like the
as
pejorative, right?
Providers,
larger
community,
consumerism of America or Western cultures is kind of marketing this as a sort of spiritual approach, right? Or even kind of some forms of yoga or mindfulness that is, again, very much viewed from that Western lens.
That brings up the question of how are you regulating the nervous system without grounding?
Yeah, you can't.
In dissociative state.
You can't. Grounding is what you do. That is the hallmark of dissociation, or the hallmark treatment for dissociation, is you have to ground them, right? Like that's just best practices.
If you're not grounded, you're not regulating. Yeah. So are these people who are going through this without the therapeutic a component with therapists on helping them regulate their nervous system and their responses. Are they literally being harmed? I mean, we talked about it. We keep talking about it, but that's huge and concerning to me, because if they're dissociated, they're not grounded, they're not processing it with their nervous system grounded, then that's not a healing experience.
Yes. Yeah, it's not. And kind of bringing up this point too is, are you really having a spiritual experience if you have to use a substance to get there, right? Like, is this actually healing or enlightening if you're having to use something outside of yourself to access this part of you, to access, higher knowledge? And well, yes, it might maybe kind of help maybe remove some defenses. I think that's kind of, from a sort of psychoanalytic perspective, maybe where the idea that it can be so helpful. If you're not able to access that on your own, which is really what we should be promoting in therapy, right?
So they can continue it when they leave.
Right. And that self-actualization piece of like, I am whole and of myself. I don't need the substance to get to a place of spiritual enlightenment. I can seek that within me.
I can self-regulate. I can be able to manage this without the therapeutic process.
Yeah.
Wow.
So,
I love that we're talking about this today, because there's so much more coming up.
There is, yeah.
Anything else you want to talk about that? Because there is something that I missed that I do want to highlight real quick.
Oh, abusable can be used on the streets. Is that
promoting and prescribing hallucinogen to people who have significant mental health concerns, such as schizophrenia?
Yeah.
I mean,
drug-induced psychosis. I mean, we know that is...
We're going to promote the psychosis state of hallucinating to people who have already hallucinations.
Right.
And then also I've worked with people with schizophrenia, and I've had, chronic schizophrenia that is very combative and aggressive. And would I want to give them a substance while processing some of the information that they might be going through? Part of me is like, maybe they're sedated a little. That might help. I'm going to be honest. Is like, if they are at that level, like having a substance, bringing them down, that could help with keeping them at a level that is more maladaptive of being able to help work with them and regulate their system. But then are we promoting more hallucinations? And then the negative outcomes that can happen with, now we're reinforcing, we're treating someone with hallucinations to cause hallucinations.
Right.
And then they're going to go out in the world.
Yeah. And then that is, that's really tricky, because then I'm just kind of putting it together. I got distracted by the rain out there. I apologize.
I heard it.
But, right, it's that, are we doing more harm than good?
Yes,
right? Because then we're keeping them in a state. Because, one of the hallmark symptoms of schizophrenia, not only hallucinations, is, feeling disconnected from others, because cognitively and you are not able to connect with others.
Yeah, and distorted thinking.
Right.
So we're taking someone who has distorted thinking, and a lot of people have paranoia. And then they can become aggressive with other people. Right. Not all. This is just some severe symptoms that you can see. And then we're going to put them in a state causing hallucinations.
To further agitate that.
Yeah.
And, the thing it brings up for me, too, as we're talking, I'm sort of just verbally processing this out loud, is, it could be really... I just lost my train of thought. I apologize. You ever have one of those days?
Well, I was just here, trying to put words to exactly, we have information that's coming to us, and we're processing it even in real time here, talking.
Right.
And I feel like it's so vital to be talking about the benefits and the effects. But no, I don't know what you were going to say.
But honestly, maybe what I'm sort of saying there is kind of what I'm so sort of maybe somatically even experiencing of this kind of disconnection from myself and from my brain and from my own ego.
We're promoting dissociation.
Yeah.
And hallucinations.
Yeah.
which is perception wise just can be distorted. And if we're having hallucinations and it's changing our perception, then what are we developing?
And then we don't have a strong sense of ourself.
And we don't have a strong sense of self. Wow. I mean, we can be bringing in more mental health concerns of developing. Like, let's say they don't have a schizophrenia diagnosis. They have, let's say, major depressive disorder and suicidal ideation. And then now, because of the medication, they develop that one disorder that has hallucinations with it, then they can develop schizophrenia. I mean, so the potential of developing even further mental health diagnoses and experiences is really concerning in some cases.
Yeah, which kind of goes on to the takeaway page of like, if as a client or as a clinician, you have a client who has a high prevalence of dissociating in session, if you're a trauma therapist and you work with someone who is prone to dissociation or someone who has a history of psychosis, this is not really in my clinical opinion, I don't think this is a good fit, right? Because that is putting them at increased risk. It's just going to further exacerbate sort of the symptom you're actually trying to treat.
Yes.
The other thing I wanted to mention was addiction, but addiction, right?
Addiction.
Yeah, I mean, as you said, this like increases dopamine, right? And
yes, dopamine, GABA.
All right, all of those,
which can be abusable.
Yeah, and it can feel really good.
It can feel really good,
and it's a great way to avoid what you're feeling, which promotes this as sort of an avoidance-based coping strategy of, well, if I don't want to remember my trauma, or if I don't want to remember this negative feeling, or not even if it's connected to trauma, but maybe I just feel sad, right? And I think the solution to feeling sad is to alter my consciousness in some way.
Wow, yes.
Then I'm
developing unhealthy coping mechanisms, which is what substance use disorders are derived from.
Exactly.
And 97% of people with trauma have 97% of people who have substance use disorders, have also PTSD and trauma diagnoses.
Yeah. I mean, what's the quickest way to get you into another state, which is what, that's really what
avoidance factor.
And that's what substance abuse is based around, right, is homeostasis. I don't want to be too agitated. I don't want to be too low. I want the opposite, right? It's a form of trying to regulate oneself.
It can be, yes. Yeah. That's one theory, is that it is an unhealthy maladaptive coping mechanism of utilizing it and using it when someone is upset. They don't know how else to cope.
Yeah.
It can be a learned behavior from family of origin if there is substance use disorders, not just a biological component, but both. And so it can be modeled behavior that's what they go to. So, and if we're treating people who have already substance use disorders with an addictive substance, and I don't say that lightly, but then we're administering this promoted cure-all medication in a way, for lack of a better term, of a new age way of dealing with substance use disorders. Are we really hitting the receptors that, let's say they are a heroin addict or an opiate addict, whether recently they've been in remission or maybe they're not.
Yeah.
And ketamine and heroin have been very well known in the community to mix.
Yeah.
And it's also with ecstasy and MDMA.
Yeah.
A lot of chemicals mixing it together. So the risks of developing is important of a substance use disorder. Which
also leads to the conundrum of, because I don't, again, it's not well regulated. We don't know how much one prescriber is prescribing one client versus another.
We're going to get into that. Yes.
Right. And then
what do they call those clinics? The clinics that hand out a lot of prescriptions just willy-nilly, if you will. Like almost to anybody. Dispensary type of clinics.
Yeah.
And not just like dispensary of legal substances, but there's certain providers, and not all providers, but there are certain providers who see the dollar signs. They see the money and they promote substances and write prescriptions just because they want the money financially. And the people usually in the community, they communicate. in the culture of using substances. And so if it's abusable, then hey, I see this person, they give me ketamine, I can take it at home. Hey, you should see them.
Yeah. And then it just kind of goes up from there, right? And then let's say you do get even a high dosage from that said provider. When you're out, you might need another high. You might need an even bigger high, right? And
more
so
of a prescription, they come back.
Right. And then, but that's also where kind of mixing can come in is, well, this isn't enough. I need something more, right?
Yes.
It's the always searching for something outside of myself, which is the hallmark of any addiction, but also a lot of trauma, right? Of I'm never enough. I need
the shame,
something.
The guilt, yes.
Right. And I need something to fill me up because I am unable to do that on my own. So, yeah, there's lots of things we need to consider.
There's a huge correlation with how the opiate pandemic has started, and we're in right now, which, if you're not aware, has basically almost doubled since COVID. And people are not talking about it. There's more people who died from the opioid pandemic during COVID than people who died from COVID. But we're not talking about it. And the ages are getting younger and younger.
Right.
And I know that it's well known in the Woodlands about a year and a half ago of a young couple who went to one of the high schools, who actually overdosed and passed away, and her mom, I believe it was her mom, found her. So there is a huge concern. And that's not just in the Woodlands here. There's other communities. There's a significant amount of damage that is being done with the opioids and opiates. And a lot of that has to do with how it was promoted. You talk to providers who are educated in substance use disorders and that understand of opiates and the pharmaceutical way that they promoted it with the pharmaceutical companies, telling doctors that this will cure and this will take pain away. Now we're being told that ketamine, with the same rhetoric, exactly same rhetoric, the same messages, you're hearing it with mental health providers, you're hearing it with medical doctors, psychiatrists, and that's what's honestly in some way concerning to me is how it's being promoted and how it's not regulated as well, even worse off than the opiates.
Right, and so quick too. Like, it seems like everybody's trying to get on this wave, and I mean, I know so many providers who are like, I need to get trained in this, and you know, and to be fair, that kind of is very commonplace in the field of psychotherapy. It was EMDR a few years back. IFS and somatic experiencing is kind of, I think, now the new wave, but also sort of ketamine-assisted psychotherapy. And I think anytime a quick fad comes on like that, we always should look at it from a skeptical lens, because
not just jumping on the boat, actually educating yourself as we are doing and trying to promote for you.
Yeah, and you may decide that as a clinician, right, or again as a client, this might be for you, and that is A-okay. And if you feel like it is helpful for your treatment, it can be very empowering. But again, it's looking at the whole frame, right? And
I would encourage you to get increased liability insurance.
That as well.
That is
which
something I would encourage.
Touch on.
If you do decide to do this, because there is so much liabilities, as we just talked about, that could be happening. So if this is something that you want, which we are promoting, just education.
Yeah.
We're not for it. We're not against it. Just education,
just
and there are a lot of concerns. So the liability factor is just a reality that we have to talk about.
Yeah. I'm glad you mentioned that, because I don't think we even included that on our slides.
No, we didn't.
But liability is so important.
Takeaways, I think, unless there's anything else.
Yeah, so takeaways, I think what I'm really taking away from this and from the research that I did, one, be mindful of something that's ever being promoted as holistic, right? And we need to understand the origins, and we need to give credit where credit is due, right? And perhaps maybe before we rush into using ketamine-assisted therapy, we really need to maybe educate ourselves more on holistic healing practices in general as psychotherapists, and those respecting the cultures from which they come. But also with that, from the research, what seems is most helpful is if you do decide to utilize ketamine-assisted therapy, doing that in conjunction with psychotherapy. So working with your therapist, however that process looks for you. For me as a therapist, I would lean towards, for liability reason, providing the safe space for the client, making sure that you're able to monitor them and de-escalate them just for, not only their safety, but also, your own protection as a mental health provider. But it needs to be done together.
And also vetting your clients and making sure that they're appropriate for this process. For me personally, if I was going to vet in a private practice, I probably would not feel as safe unless there's, some other thing that I'm not aware of with working with the schizophrenia population, people who are, who are diagnosed with schizophrenia, with private practice alone in a building and with ketamine. I just don't feel like that would be a safety thing for me personally. That maybe in a different setting, like the clinical setting and in the hospitals or the clinics, that would be maybe more appropriate. So referring out if needed for those types of clientele.
Also think it's important their legality, right? Like maybe consulting with either your malpractice, oftentimes they'll have a legal team that you can kind of ask questions with, but also creating paperwork for if you are going to do this treatment and coming up with a protocol if something happens, what are that individual's emergency contact and blah 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 blah
emergency processes and protocol and
who,
what the steps would be
and who would you call and all of that, so something to consider as well. Thank you for helping.
Well, like also I stress the importance of having a release of information for emergency purposes, or at least a contact to call if there is an emergency, but also maybe having the information of a medical doctor for the clients, their medical doctor that you could reach out to if there is a medical emergency during the process. I think that would be very important.
And I would definitely get an ROI to consult with the provider too who's prescribing the substance, because you would want to consult with them, right?
Or maybe reach out to them if there is an issue, right? Because they would honestly be liable for the medications that they administer, for one, but also then they can help you because they would hopefully have the education and experience to be able to guide you in knowing what to do. Or best practices.
So potential concerns, just to kind of touch on that, substance abuse history could increase rate of relapse, right? That's always the concern there. We talked about also clients who have maybe are more dissociative prone, or have a history of psychosis. There's a lot of concern there, right? Of maybe even activating an episode of psychosis. And then also, potential normalization of avoidance-based behaviors, right? And is that something that, I think we always need to be mindful of, is what we're administering as a treatment, whatever it may be, is this going to be helpful in the long run for the client, or could this further exacerbate maybe kind of some maladaptive coping that's already kind of there and that's present?
Yeah, exactly. And I think that it's just important to know those risks and potential risks. But there's also a lot, there's studies out there to support that it's helping people with a lot of diagnoses that are drug resistant, right? They talked about the TRD, treatment resistant depression. And so, I think it's important to weigh out the pros and cons for each client specifically.
And it could be a very creative form of psychotherapy. That's maybe why there is some benefits, right, with sort of treatment resistant depression, right? Is there something about kind of getting out of your head or thinking in a creative way that maybe can have us examine the problem, but also what are other creative based therapies that maybe we can utilize in session too.
Exactly. So, and how to manage it. I wonder how that would be in conjunction with other therapies. I didn't think about that until now, of being a holistic trauma therapist and really promoting an eclectic approach. I'm wondering if ketamine could be a therapeutic component with other avenues of therapy that could maybe bring them to a different level.
Yeah, right. More like kind of holistic, and I'm even sort of seeing this as kind of like a collaborative care approach, right? Do you have a psychotherapist who maybe is doing traditional talk therapy, and then a therapist who does ketamine, assisted therapy, right?
Yeah.
But also, like, I'm thinking of, probably because I'm Reiki trained, right? Yeah. Integrating Reiki into this, right? Like, and integrating acupuncture and herbalism and other things that could be maybe potentially helpful as well.
Yeah, exactly. And I think you talked a little bit about that when we first met, or not first met, but when we were first talking about this, is utilizing it with other approaches as well, of like, okay, how can I help my clients with utilizing holistic approaches that you already do, but also bringing them to a different state of alter enlightenment through this process.
Yeah. And that's one thing to kind of consider, right, is how do you integrate these two, right? And how do you integrate these two worlds, especially when one of these worlds hasn't really been empirically supported by data and research.
Evidence-based, if you will. Right. I mean, they're trying to work on it, getting information, but more is needed.
Yeah. And so, I think that's kind of a question that every therapist has to kind of ask themselves. The way I've kind of found to integrate these two worlds, right, is viewing Reiki from a frame of integration, right? So if we're just, working with someone and assessing their chakra system and then putting their chakras in alignment, it's a form of integration, right? And
so utilizing integration techniques and therapies with ketamine, I could see that could be a very impactful therapy session.
Right. Yeah. It could definitely be that. And, I don't know how maybe Reiki being administered while doing ketamine, that's something that I don't think I would personally feel comfortable with as a clinician. But, I think, time will kind of evolve, and as these maybe more traditional healing methods become more commonplace and hopefully talked about more, maybe we'll find some balance between these worlds. So, yeah.
Well, very enlightening for me, and I think that's my overall word for all this, is that I find that even through the process, I guess enlightenment, I keep thinking of like Buddhism and like other cultural components of a higher level of enlightenment, and that's kind of how this is being promoted, is that. And that's why I feel like that's kind of my theme of promoting the promotion of and marketing of an enlightenment, because they're also seeing that ketamine in the brain is showing integration in the middle, which is very different than what a lot of other approaches have done in chemicals. So they don't really know what's going on in the brain during this process.
And there could be something to that, right? Sort of that white matter in the brain, and then like connecting the midpoint, which is what we want, right? We want the integration. But again, it's just time will tell, and we need research, and we need also protocol. We need best practices, and we need to make sure that we are putting our clients' best interests. One piece on enlightenment that hopefully this won't send me down another tangent. But
it's welcomed.
Well,
whatever.
I appreciate it. It's making me think of the search for meaning, or search of meaning. I'm so sorry. Man's Search for Meaning, Viktor Frankl, right? Like, really, and that's really what the core of enlightenment is. And whether we want to say enlightenment in a spiritual sense, or we want to say integration from a trauma perspective or a therapeutic perspective, actualization might be another way of framing that. Individuation, integration, right? It is all about making the meaning of it, right? Is that like reaching a point of clarity, reaching a point of understanding, and that process in and of itself is always cyclical, right? There is never one cure-all, be-all. And so
it's a personal to the person.
And that's the thing too, is this needs to be, as holistic trauma practitioners, whatever techniques, theories, approaches you use need to be specifically catered to the client that you're working with.
100%. I agree. And so this may or may not be a good fit for some people based on what their experiences are, and they may have a positive experience, they may have a negative.
Yeah.
And if we go with the statistic of 50% from, you know, the Netherlands, the US, and Australia, with the meta-analysis, it looks like there's a 50-50 in some cases of having a better outcome for clients. As a provider, I think that there's a lot to look at as well and educate on what that entails. And is there a required certificate right now for that?
Not that I am aware of.
That's what I'm aware. Yeah,
trainings offered, but I'm not aware of a required one.
Yes,
yeah.
And per state is probably going to be different.
Mm-hmm.
I mean, we're going to probably see a rollout of state regulations, more so, because that's going to be different, typically per state of how therapy is administered and regulations. And just because it's FDA approved does not mean the federal government is going to regulate it.
Yeah. Mm-hmm. Yeah. Which, you know, also kind of leads into, not only is this maybe a for-profit, for lack of a better word, scheme for clients, but also for therapists, right? Because if now there's going to be all these trainings required and then state legislator, well, that becomes a very profitable business in and of itself for clinicians to...
Which we haven't really had a part in that. Yeah. As much as psychiatrists and medical doctors.
But, well, and also I'm just more thinking of, well, then all these trainings that are going to be required and stipulations and things of that nature, right? And, you know, it does kind of seem that, again, this kind of, we're viewing something that is traditionally healing in a lot of cultures, but from a Western frame, and kind of promoting this sort of capitalistic view of it.
Yes.
Yeah. So.
Yeah. That is very important to look at. And as holistic providers and the therapies that we use, we're not the first people typically to use these type of techniques. So even we could say that the therapies that we're providing and we're having a profit on, we're kind of taking an eclectic approach, or taking methods from other cultures and utilizing them in the therapeutic process to have a profit in a way. Yeah. But a lot of providers that I see as therapists, they're giving a lot of themselves in genuine, usually. I mean, I haven't seen a lot of therapists who are not genuine in their approach of wanting to help heal and support. So I'm hoping that would outweigh some of the other experiences.
Yeah. Well, and I think too, there's been healers, right? And I think we've kind of touched on this as therapy can be seen as a form of healing. Yes. We can be viewed maybe not from a Western lens, but other lenses, right, of being a form of a healer. And, you know, I think there's a place where all of these things can kind of be integrated, right? It's not that it needs to be kind of, you know, there's only one way to do therapy and there's only one way to be a healer, or vice versa, but it's the understanding how it is all kind of connected, and having respect, right, for other cultures, and also, you know, knowing where these practices come from, right?
And honoring that and really taking acknowledgement of those practices. Yeah.
And also how their practices have maybe informed some of our own. And
how would you honor someone else's practices of a different culture into the therapy that you provide?
Yeah. So I think first and foremost is to be a learner, right? Like, don't assume that you are the expert on said topic, and maybe drop all preconceived notions of how that healing process should look, right? Like, you know, even for myself, when I was sort of learning about the chakra system and, you know, really kind of where it comes from of, you know, tantric yogic practices and kundalini and all of that, is I have to look at it from that frame of reference as much as I can, with my own biases and worldview, having grown up in Austin, Texas, and having my Western worldview. But, you know, it's important to see it from their frame of reference as much as we can. Yeah. Right? Because if we're not doing that, then we're not actually being multiculturally competent clinicians. And so it's that ability to perspective take, to sit back, to learn first before making assumptions, right?
Yes,
And
100%. I think that's important to value other people's cultures, and maybe this is a part of their family culture, is taking a hallucinogen or using a chemical substance, and honoring that and providing a place for people to feel safe, that they can come see a provider who does offer a non-biased, supportive view of traditional cultural aspects. And I think that's really important to really consider.
Yeah. And how do you integrate that, right, as a clinician? And you know, how do you, and I think each clinician needs to decide what's best for them, right, and what level of risk that they're willing to take. But you know, seeing your clients as whole people, and also being open to maybe their own healing practices that maybe differ from what we believe is best practice.
Keeping their autonomy.
Yeah. Well, thank you for having me, Nora. This has been awesome, and I feel like we've segued a bunch of different ways, but hopefully it'll be helpful for people watching and give them something to think about. So.
Yeah, I think it's amazing, and I really appreciate it wholeheartedly, and I just love meeting with you every time and talking about fun stuff.
I know.
This is fun for us.
I know.
At least for me, and I can sense that from you, so I hope that maybe we can do this again in the future. And I'll also put your website on the link. I try to put the websites there. We will have the PowerPoint that we developed. It will be put up with a link for you to access, so you can have your notes. You didn't have to take notes unless you wanted to, that's okay. But I'll have a link for my website as well, and any information that I feel would be supportive of you through this process. Thank you so much, and I hope you have a wonderful day.
Bye.
Bye.